All right, welcome back, everyone. We're
Wow.
diving into cardiology today.
Yeah, cardiology.
It's a topic that honestly can get pretty complicated,
For sure.
but it's so important, right? Like we all have a heart, and understanding how it works and what can go wrong, well, it can make a huge difference in our health.
Absolutely. And, even just feeling more confident talking to your doctor about it, that's a big win.
Right, like decoding all that medical jargon so you can actually understand what's going on. So that's our mission today, to break it down, make it clear, and hopefully even kind of fascinating, right?
Definitely. I think we can make it fascinating for sure.
Okay, great. So you've been spending a lot of time with some cardiology research lately,
Yeah.
and you flagged a few things that really stood out to you. So where should we start?
Well, first, got to start with the basics, right? The heart is this incredible pump.
Yeah, the engine of the whole system.
Exactly. It's constantly working, circulating blood throughout your body.
It's kind of mind-blowing when you think about it, like nonstop action, 24/7.
Yeah, and it's not just the heart, it's this whole network, right?
Mm.
Arteries and veins, like these highways, carrying blood to every single cell.
Okay, that's a good analogy. And it needs that blood, right?
Mm.
For oxygen, nutrients, all the good stuff.
Yep, got to keep everything running smoothly. But, like any complex system, things can go wrong.
Right, and that's where those tricky terms come in. You mentioned arrhythmias, I think.
Yes, arrhythmias, basically, it's when the heart's rhythm gets messed up. It can beat too fast, too slow, or just irregularly.
And there's a whole bunch of different types, right?
Oh, yeah, tons. But one of the most common ones, and one you specifically asked about, is atrial fibrillation. AFib for short.
AFib. I've heard that one a lot, but honestly, not sure I totally get it.
Well, think of it this way. The heart has four chambers, right? The top two are the atria.
Okay.
So in AFib, those atria, they kind of quiver instead of beating properly.
Quiver. That doesn't sound good.
Yeah, it's not ideal. It messes up the whole flow of blood.
And that can cause problems, right?
Yep.
Like serious ones.
Exactly. It can lead to fatigue, shortness of breath, and even increase the risk of stroke.
Wow. Okay. So in the research, we saw a bunch of different things that can trigger AFib, right? Like high blood pressure.
Yep, high blood pressure is a big one. But also heart valve disease, sleep apnea, even things like too much caffeine or alcohol.
It's kind of scary how many things can contribute to it.
Yeah, it's complex for sure. And that's why when someone has symptoms, it's crucial to see a cardiologist.
They're the heart specialists, right?
Exactly. They can do a bunch of tests to figure out what's causing the AFib and how to treat it.
Okay, so let's talk about those tests. One that came up a lot was EKG. What's that all about?
EKG stands for electrocardiogram. Basically, it's like a recording of your heart's electrical activity.
So they can see if the rhythm is off.
Exactly. It shows how fast the heart's beating, the rhythm, all that. Super helpful for diagnosing AFib.
So it's not just about saying yes or no to AFib. It gives them more information, right?
Right. Absolutely. The EKG can actually give clues about what might be causing the AFib in the first place. Like certain patterns could point to heart disease or valve problems. It's like a puzzle piece.
Yeah, okay, I'm starting to get the picture. And then you highlighted an article that talked about AFib and stroke risk, which sounds really scary.
Yeah, that's a big concern. You see, when the atria aren't beating effectively, blood can kind of pool in there.
Oh.
And that can lead to clots forming. If a clot breaks free, it can travel to the brain and cause a stroke.
That's a serious risk. So what can be done to prevent that?
Well, one common approach is blood thinners. They help prevent those clots from forming in the first place.
Makes sense. But are there other options?
Yeah, sometimes they might do a procedure called cardioversion. That's where they use electric shocks to reset the heart's rhythm.
Whoa, electric shocks. That sounds intense.
It can be, but it's often very effective. And then, of course, there are lifestyle changes like managing stress, getting enough sleep, things like that.
So it's not just about medication or procedures. It's about taking care of yourself overall.
Absolutely. It's a whole body approach.
And I think that brings us to another important point from the research. Communication. Like how we talk to our doctors about all this.
Yeah, that's huge. Don't be afraid to ask questions, even write them down beforehand so you don't forget.
Right. And be honest about your symptoms, even if they seem small.
Exactly. And don't be shy about asking for clarification. If you don't understand something, just say so.
Sometimes medical jargon can feel like a whole different language.
Oh, totally. And it's your doctor's job to explain things clearly. You're a team working together for your health.
That's a good way to think about it.
Ah.
And it's not just about talking. It's about listening to your body too, right?
Absolutely. If something feels off, don't ignore it. It's always better to err on the side of caution.
Especially with hard stuff, right? Like chest pain, shortness of breath, those are red flags.
Definitely. Early detection is key. It can make a world of difference.
Wow, okay. We've covered a lot today. AFib, EKGs, stroke risk, communication. It's a lot to take in.
Yeah, we've been on quite a journey.
But hopefully it's helped to demystify some of these cardiology concepts, like feeling a little more comfortable, a little less intimidated.
That's the goal. And remember, knowledge is power. The more you understand, the better you can advocate for your own health.
Absolutely. So keep learning, stay curious, and until next time, take care of those amazing hearts of yours. Thanks for joining us.
See you next time.